All right, here we are. I've got Dr. Meggie Graham here for our Mouth Breathing Awareness Month, and I'll give a little background first. So basically what I'm doing is every day in the month of May, I'm doing an interview with somebody who is a MyoMentor graduate. So I know you had your hygienist go through my MyoMentor program, and I'm super excited to share your story because I feel like if I can get stories out there, if people can hear stories from dentists and hygienists and healthcare professionals about these airway and tongue tie and mouth breathing issues, now we can start to make a difference in people's understanding of this stuff. So I'm excited to hear your story today. And today's May 10th, so we're on day 10 of Mouth Breathing Awareness Month. So you are a dentist in Milwaukee, Wisconsin, and you've been doing some really cool stuff. I'm excited to share with people because you've got your general dental practice, Lake Park Dental, and then you also have this new really cool tongue-tie airway clinic called Untethered that you have started recently as well. So why don't you start off by just sharing kind of who you are, your background, how you're, in this world, and then yeah, we'll just go from there.
Well, thanks. Yeah, I'm excited. I'm excited to be collaborating and getting to tell my story.
Me too.
It's funny how many different little worlds start to collide, and I'm sure you've heard some of the same stories from other dentists or dental hygienists. But yeah, Lake Park Dental is a general, comprehensive, family cosmetic dental practice, and I started noticing. Maybe 4 years ago, 4 or 5 years ago, started just noticing or wondering why some of my patients had chronic issues that I thought shouldn't be there. They had great hygiene, they're coming in all the time, but why were some of my patients unstable? And that led me down a CE rabbit hole, a continuing education rabbit hole. And my very first aha moment was listening to Jeff Rouse at Spear connect the airway and dental dots for me. And it was like, oh, okay.
Yeah,
and then
Spear does such a good job. They're like a huge influencing force in this like airway world. I think they introduce a lot of dentists. So.
Oh, absolutely. And I think one of the things that I find to be so admirable about them is that they're this huge organization and they have everything kind of set up and they have protocols and systems and, their entire curriculum set up. It would be very easy to put their blinders on and just kind of keep cruising, but to really shake it up and do the uneasy thing to change their curriculum based on knowledge and science that we keep learning about is amazing. And that's going to influence so many more people like me to be able to ask questions. And I tell patients this all the time, a lot of my screening questions, a lot of what I'm looking for is not to create a problem, it's to hopefully rule out problems. But I think that so much of what we do,
bigger problems too.
Yeah, absolutely. And even from just a dental perspective, I just think that so much of what we do is avoidable.
Mm-hmm.
That if we could understand the why behind it and really get to the cause of somebody's issues, and so often it's sleep or breathing, you would cut us out of the picture, which is the goal. I mean, luckily there will always be a need for dental work, but truly I think that no intervention or less intervention is should be the
for patients. That would be better, so I mean, you guys are always going to be needed, but so you learned about the stuff through Spear, and then like what was it that what was kind of that light bulb? Was it to do with breathing or sleep or tongue tie, or what was the first thing that caught your attention?
Well, one of Jeff's favorite quotes is just do dentistry, but then he really links the demise of the occlusion or the teeth and restorations to fragmented or disrupted sleep and obstructive sleep apnea or upper airway resistance. And so starting to see that connection was the first step. And then from there it was, well, why do some people have fragmented sleep or breathing problems? And I know that that's multifactorial and there's a lot of comorbidities that go into that, but from a dental perspective and a mouth perspective, these patients all have a lot of things in common. And almost exclusively, it's a lack of tongue space. They just don't have room for their tongue.
Yeah.
And so that was kind of my second light bulb moment. And then the same question, why don't they have enough tongue space? Which then introduced me to myofunctional therapy and dysfunctional movement and dysfunctional patterns of the tongue and how that really influences the growth and development.
Yeah.
So that we end up with not enough room and you end up with dental crowding. And so that was my next moment of, so, when I started to be able to recognize this, I really started with my adult patients and saying, okay, how can we influence you and redirect your path so that you fall into a lower risk for the need of dental work? And then coincidentally, wouldn't it be great if you were sleeping better, you were feeling better, all these other health systemic things that were going on in your life? What if they were connected?
Yeah. And we know they are, but I think connecting the dots for patients, it's harder to see when, especially when they're just like, I'm just here to have my crown fixed, or like, I just need a cleaning. Like, why are you talking to me about this stuff?
Absolutely. And I think that when I first learned it, I was talking, I talk too much in general, but for sure then really going way too far, and people are staring at me like I was crazy. But then to really connect it back to why, as a dentist, I care about it, I think it does connect those dots. And helps people understand why we're even looking for the problem to begin with.
Yeah. So it started with your patients. When did it start to get more personal with either your own family, your own kids, yourself? I don't know. I'd love to hear that.
It started with me, all of a sudden listening to these lectures and realizing in myself, I was a headgear patient trying to hold my maxilla back to correct my severe class 2. I was aware that I didn't like my smile because it wasn't broad enough. I didn't like how my teeth were flat across the front. And I remember asking my dad, who's a dentist, if he could make my canine teeth pointier. And I didn't know, I just still hadn't connected all of this, but I knew a lot of what I didn't like about my smile. And then to start to realize that that was related to
that's so interesting.
Chronic insomnia, having issues sleeping as a child, and then starting to recognize, and so when something becomes personal, it's impossible not to become passionate about it. Sorry, I don't know where my video went.
There you go. That's okay.
Sorry about that. I didn't put my phone on do not disturb. Do that. There we go.
And then just
sorry, Sarah.
That's okay. Don't worry at all. We're casual around here.
Okay, there we go. So hopefully now we won't have any more interruptions.
Perfect.
Sorry about that. So
once it gets personal, it's hard to not look at it.
It's hard not to be passionate about it and to know.
Yes, that's what you said.
And I think that I'm fine. I think that I've turned out okay. I'm a pretty happy person now, but thinking about the struggles with insomnia and anxiety and the amount of dental work that has been done and repeated, and if I could help somebody connect those dots and just change their path and avoid some of the things that are avoidable, that would be fantastic. And if that means helping somebody in their 60s, so be it. But if we can recognize it when they still are growing, I just think that's even more important. And so that's how the rabbit hole became this crater of starting with these adult patients. And now, a big portion of my practice is recognizing it in little kids.
That's really good. Can you just connect the dots really quick between, you mentioned insomnia and anxiety, between some of these other things? Like I'm talking about mouth breathing. So I could just think of a patient listening to this, like, how is insomnia and anxiety, how is that even related to mouth breathing? And like, can you kind of connect those dots for people who might not understand?
Well, first of all, I didn't know that we weren't supposed to breathe through our mouths. I didn't know that I breathed through my mouth.
Even if it was at night, right? It could just be
right. Or I think it was Jeff that introduced me to Patrick McCune's book, Close Your Mouth and the Oxygen Advantage. And I remember reading Oxygen Advantage on the plane on my way home from a course and recognizing, wow, I breathe through my mouth all the time. I can't breathe through my nose. But the connection of that is just starting to realize that when you're mouth breathing, you don't have the same cycles of sleep, the same benefits of deep parasympathetic sleep that you would if you were without effort breathing through your nose.
Yeah.
And so is that what you're
asking? That's perfect. And then you do that for long enough, basically your body's in this fight, flight, sympathetic state for long enough, and you're not getting oxygen. And now this is what leads to some of that anxious state that can often go hand in hand with the UARS, especially,
Yeah. And, I think that also we're in communities and we're in a society that it's completely common. And just because it's so common doesn't normalize it. But you walk around and you're hanging out with all your mouth breathing friends, and we're bombarded with pictures of snoring characters in movies and cartoons, and we just think it's normal. So I think that the realization and then the connection and then trying to piece that together was huge.
So did you start to kind of look at yourself and go through, like, like dentally or orthodontically or like surgery wise, have you done anything to help your own breathing and stuff?
I'd already been through a couple of nasal surgeries to correct a deviated septum. So then the connection between why somebody with a really small, narrow mouth with lack of tongue space is more likely to have a deviated septum was another connection, so that if the roof of the mouth is really narrow during growth and development, the septum can't stand up. So it's more likely to be deviated and then create some airway resistance there. So that was, I just started checking all these boxes. And I started with the simplicity of mouth tape, thinking that was crazy, but trying mouth tape. And for the first time, I started dreaming and feeling rested. And
wow. Yeah.
That was kind of the, okay, I'm all in. Let's keep going. So from there, I went through adult orthodontic expansion.
Cool. Okay. I didn't know that.
Yeah, I had an MSc after learning through Rebecca Backau's courses. So I went through that, and then went through surgically facilitated ortho treatment with Rick Robley and my periodontist here, Lisa Teal. So yeah, I'm just actually now getting to the other end of my orthodontic journey, and I'm ready to start to finish the restorative work and close some of these odd gaps in my teeth.
That's so interesting.
It's been really cool.
Yeah, I need to learn more about all your stuff. I know I've talked to a couple other dentists, like our mutual friend, Courtney Levine, who's actually going to be doing one of these interviews too. And, learning from you guys, like, I need to do all that stuff too. And I'm just like, what are the right steps? What's the right timing? And it's hard as an adult. Like, I get what adult patients have, these decisions they have to make around, like, do you want braces? Do you want expansion? Do you want surgery? If we can get kids young, like you said earlier, we can avoid all those decisions and like bigger deal things later. So.
Well, I think it's been very helpful for me to have lived through it and to see the quality of life changes, because it's a lot. It's extremely, it's doable, but it's invasive and it's a commitment. And I rocked a huge gap between my teeth for a long time. And, but to be able to live through it and say, it's absolutely worth it, I would do it again, I think carries a lot of weight with it. But to also start to realize, to ask the question of the why and recognize that, well, my tongue was never properly functioning. That's probably why my mouth didn't develop in the right way or the optimal way.
To begin with.
I had a grade 3 tongue tie, and I went through myofunctional therapy and had Dr. Zaghi do the surgery, the functional frenuloplasty for me after I was done expanding. And so now I'm on the other side of it, but what a commitment, what an interdisciplinary commitment to go through all of it.
But you did it, and now at least when you talk to patients, you can say, hey, I get it, like, I've done this, like, and I know it's a lot, but at least I think, and that's one of the reasons I wanted people to tell their stories so much. Like, if patients can hear this stuff, then it doesn't become just like this theoretical treatment you're recommending. It's like, no, you're super passionate. I'm super passionate. Like, I want people to see, like, that we're serious about this. Like, it is important, and it's not just stuff we tell you to do for money, like, it's really not.
Oh gosh, I've so often, for a while after first hearing or first connecting the dots, I think it was my accountant that was like, oh my gosh, can you go back to doing restorative dentistry and stop talking? You're not making any money. I think that there's a lot easier ways to make money than trying to save people by fixing their airways. But it's amazing to me. I just thought I wasn't a good sleeper. I thought I was always going to have sleep problems, and now to love my sleep and know that I'm going to get good quality of sleep, minus my little kids waking me up sometimes. I think that's hugely influential in making it worth talking about it with other people. The other thing, I started to see it in my own family. I saw it in my nephew. I saw it in both my nephews and my niece. I saw it in my sister, my brother-in-law. But then when I became a mom, that was another very influential moment. And I missed it with my daughter. So what we've been learning is that there's a lot of different thoughts as to why some people have restricted tongue mobility and how other people don't have tethered oral tissues. But there is a dominant trait, a genetic trait to that. So it's not uncommon to start to see that run through a family line.
Yeah.
Knowing that I'm tongue tied, my husband's tongue tied as well. So we've got double whammy coming at our kids, but I didn't know about tongue ties when I had my first daughter.
Yeah.
And it wasn't until she was 18 months that I realized that she has a very significant tongue tie. And now I'm watching her occlusion develop. And I think back to our nursing journey and how difficult that was.
And you can tick all those boxes.
All the sleep issues that we've been going through with her. So when I had my second daughter, I was much more prepared to look for it. And she also had a tongue tie. But I also was ready to have the support in place to have her treated, to have a lactation consultant and body workers. And our journey is so different. She's almost 16 months, and we joke that she probably won't stop nursing until she's married. Whereas my other daughter was 9 months old and self-weaned because I, in retrospect, realized she wasn't getting enough milk from me.
This is hard. I'm not doing it anymore.
And I hated it. It hurt, so it's just a totally different experience.
Oh my gosh. That's amazing. No, and I think this will help other moms too, because I think it's just so common in our culture. Like, women just think breastfeeding is really hard. It's really painful. It hurts. It sucks. But I don't think it has to be that way. It's just tethered oral tissues, tongue ties are so common. And that is a whole, like you said, a whole different discussion on why are they so common?
Well, I think there's so much confusion that with that confusion, there's a lot of controversy that comes, and there's a lot of misinformation, and there's a lot of, I think, well-meaning providers out there trying to help. And especially as new moms, there's already a lot of anxiety and stress and wanting to do things right, and very much a lot of conflicting advice out there. And so it's really hard to make a decision. So I think that's part of the issue too, is there's not a uniform diagnosis across all the medical lines, and people are not fully educated in how to diagnose them.
You can't go to one doctor and they'll say, oh yes, this is a tongue tie, and have another doctor agree. It is a very high chance that because we don't have that across the board really defined way of looking at it, and especially through function, like, you're so familiar with. Or
even, let's say we got lucky enough that we have two different doctors that see a tongue tie. It's one of those tongue ties you can see across the room.
Yeah.
But then you end up seeing a provider that just thinks a clip and go is good to go. And now if they do that and they scar down, or they don't have the functional help from lactation consultants or feeding specialists or craniosacral therapists or occupational therapists, their journey might not be successful. And then now the entire procedure has a bad reputation, so there's so many moving pieces that it's really hard to pin that down.
Yeah. Well, that's why I'm such a big supporter, and I always have to give a shout out for the Breathe Institute. I know you are too, and this is kind of how we got connected, actually, was because of the Breathe Institute. And I love what Dr. Zaghi is doing, putting out information, trying to come up with standard ways of doing things and measuring and getting more research. So I think that will change, and I think it's good. So
my respect for them at their, a lot like what I was saying about Spear before, but with the Breathe Institute and their willingness to keep changing and keep growing and not just getting comfortable is
for sure
huge. It's the only thing that's going to make change.
Yeah, I know. Well, why don't you tell us, we'll kind of wrap things up, but why don't you tell us, I'd love to hear more about this future kind of clinic, airway, tongue tie thing you're doing, because it sounds really exciting. And so give us a little bit of a preview of what's coming.
Sure. Well, it's interesting because it started with my dental patients, and it will continue with my dental patients with Lake Park Dental. But there are people that were starting to wonder if perhaps they struggled from either sleep issues or tongue tie issues, and they started finding my practice. And so I started becoming busier and busier with this portion of my practice, that I ended up making the decision to separate it out into something completely different, so that I could organize my hours and my message and just kind of keep it a little bit more succinct. So
because now people will see you as kind of a destination, oh, she's doing this airway tongue tie stuff, and it's going to draw attention, it's going, and so people might not be looking for a regular dentist, when they find you, they might be specifically seeking out somebody who is like an expert in this area. And so I can see how the two, it's almost like, you know, you had to separate it. So
yeah, they're really complementary, and there's a lot of overlap, and there probably always will be overlap with that. But you're right, it's definitely a specialty part of my practice, and it doesn't mean that the people in my Lake Park dental practice don't continue to have the same conversations and potentially have the same kind of recommendations or treatment. But yes, exactly. Some people are finding me for that specific reason.
Yeah, exactly. Yeah, it becomes like people are searching for, I know that because that's how my practice works. People search for online myofunctional therapy and they find me. And so if people are searching tongue tie Wisconsin, they're going to come up and find you. So that's cool. I love it. Yeah.
Yeah, it's really fun. And then the most rewarding thing is to, you know, hear the patient's success, you know, people that have had chronic head and neck issues, or moms that have been able to nurse. And even if their chief complaint or their reason why is different than my why, which is of course to help support development and growth of the jaw. But it's so amazing how many other things can be accomplished along the way.
Oh, totally.
If we're addressing that right off the bat.
For sure. No, I love what you're doing, and I'm really happy that you wanted to be on and share your story so that other people can hear and learn, and hopefully, you know, be able to look at your situation with your own symptoms and with your kids and with your patients and be like, okay, this stuff's starting to make sense. That's my goal. So I think.
Well, good. I hope I can help somebody connect the dots a little bit. Absolutely.
Yeah, no, I think for sure your story is awesome. So anything else you want to say? Any last you know, shout outs to anyone, or should we just wrap it up?
Oh, shout outs to everybody. Everybody gets a shout out. But I really think that the most influential people so far in my journey have been a lot of the people that we've overlapped with, but the Breathe Institute in particular, and then Jeff Rouse, Rebecca Bacco, they've been, Tracy Wynn, they've all been hugely supportive in helping me kind of find the next steps and what class should I take next?
I know. I don't even know what class to take next. I mean, I want to see when everything starts opening back up after the whole COVID situation. I can't wait to like do in-person meetings again. Like I miss people. Like I love that, you know, camaraderie and the excitement that comes with going to these courses in person. The online stuff is awesome. I mean, I love that too, but man, I can't wait.
Absolutely. I can't wait to travel again.
Me too. All right. Well, thank you so much. We'll wrap it up. I appreciate your story and that you sharing all this stuff. Thank you for coming on, and I guess just enjoy the rest of your day, and I'll see you later.
Well, thanks for having me.
All right. Yeah. Okay. Well, we'll talk to you later. Bye.